I'm about to tell you something that will completely change how you evaluate your next dental job offer. It's not your salary, it's not your benefits, it's not even the schedule that will determine most of your success as a new dentist. See, there's one factor that can literally double your daily production, and most new dentists never even ask this during their interviews. I'm going to show you exactly why two dentists with identical skill set can have completely different income levels, and it has nothing to do with their clinical abilities. Plus, I'll give you the exact question to ask in your interview that will literally reveal whether this practice will set you up for success or have you struggling and stressed out. But first, let me tell you about the biggest mistake I see new dentists make when choosing their first job. See, a big part of your success is going to depend on the type of dental assistants that you have at the office. Most new dentists are focused just on the salary that they're being offered, when really the quality of your dental assistants and team are going to be a even bigger compounding factor than just the contract itself. Now, don't get me wrong, the contract is, a big part of it. But once you secure that, the team that you have is going to make a big difference. And it can really be the difference between making $200K and $350K annually. Not just about money, but you're going to be able to treat and serve more patients, which is why we got into this profession in the first place. And the crazy part, there are two completely different types of dental assistants that can dramatically determine your fate. And I'll show you exactly what to look for in a minute. But before I reveal that, you need to understand something that varies dramatically from state to state. And if you don't know this, it can kind of complicate what I'm about to say. See, different states have different rules for what dental assistants can do. A state like New York, there's no real certification process needed for them to take x-rays, make temps, do final impressions, whereas in other states like New Jersey, they have to do a whole course, pass a test, and become a registered dental assistant to be able to make temporaries and take alginates and things of that nature. Even to take x-rays, they need a certification. So before interviewing, just look up these rules and regulations in your state so you don't make a mistake and you know what question to better ask in the interview. So knowing the rules are just one part of it, the other massive component of this. So one type of assistant will help you out a lot, whereas the other one will kind of make you just your own glorified dental assistant. So assistant type 1 can only do simple tasks. They can suction, flip the rooms, set up your trays, but you're doing the impressions, you're doing the temps, you may even be scanning the patient. If you're doing digital impressions, you're gonna be doing a lot of the work yourself while they kind of stand there and are kind of just handing you things. Now, type 2 is a registered dental assistant or an expanded function dental assistant in some states, which they could even help you place composites. But these assistants can take impressions, both CAD/CAM and analog. It can make you temps, advance, setup and breakdown of the room. They're more knowledgeable and can even probably, offer you advice, especially if they've been working in this industry for over 10 years. And you basically just focus on diagnosis and treatment planning and the procedures, and they do the rest. So if you're a doctor working with assistant type 1, let's say assistant type 1 allows you to see 6 to 8 patients per day because you have to be in the room the whole time. You can't really bounce around. Now, assistant type 2, you can probably see 12 to 15 plus patients, right? Because you're only coming in to do your 10-minute crown prep and you can get up, go to the next room. They will take care of the temps, and you can go in with another assistant to do other tasks or see another patient. Now, this seems like such a small difference, but even if you're able to treat 1 to 2 more patients a day, it could translate to over $100,000 more a year in income. But here's what's even more important than finding these good assistants. It's making sure that they actually stay there, which is a huge problem we have in the dental industry. There is a high turnover rate with dental assistants, and it's really hard to find A+ talent and keep them. So here is something else that you can add to your dental interview in the form of a question to better assess what they're doing to keep this A+ talent around. You want to ask not just what type of dental assistants they have, but what is this office doing to keep good talent? Now, if they kind of look like a deer in headlights, that's probably not a good sign. You want them to be spelling it out clearly. Oh, we give them a bonus every year, or their pay increases every year. We do a system of tracking their satisfaction in the office, et cetera, et cetera. They offer the most competitive compensation in the area. These are things that you want to hear. You want to ask, how do they develop and train them? And lastly, once you have good assistants, you're able to retain them. Now it's on to you to determine how you use them. This is where most new dentists completely blow it, even when they have amazing assistants. They make a huge mistake in delegation and it destroys their efficiency altogether. So when you come into the office, you cannot be scared to delegate, right? Your assistants need to understand how they can best help you, which ultimately best helps the patient. So don't be afraid to delegate. Train them to your specific preferences. Build systems and workflows together. Communicate expectations clearly and invest time into them up front. Build the rapport. If they're a newer assistant, invest the time into training them, educating them on the reasons why you do things, not just, hey, can you go get me this? Let them know you're thinking, because you'll find that once they kind of get into your head, they'll be 10 steps ahead of you, and they'll be, doing things where you're surprised, where you're like, wow, it's literally like you're in my head, And that's the great type of relationships you want. Patients notice this. Assistants love to have this kind of connection with the doctor, and it's gonna just further help you to retain them. Now, I promise you the exact interview questions that reveal all of this information, and I'm about to give you a complete list right now. So here are the specific questions you need to ask in every interview to ensure you're setting yourself up for maximum productivity, impact, and being able to help as many patients as possible. So number one, are your assistants RDAs or expanded functions? Can they take impressions and make temps? What's your assistant retention rate? How do you train new assistants? And what systems do you guys have set up to prevent turnover? Now, remember, those two dental assistants I described to you with identical skills but different incomes, you can see dramatically, at the end of the year, way more patients with one who has these skills versus one who doesn't. And your assistant is going to be the underlying determining factor in how efficient you can be, how many patients you can see, and how much you ultimately earn. So an office who has a lower daily minimum guarantee, but has great assistants, great systems for retention, you're gonna actually end up making a lot more than an office who's just offering you a higher salary up front, but you will end up having to spend a lot more of your time doing your own temps, et cetera, et cetera. So if you want more interview strategies, just career planning, or just one-on-one help, join my community where I break down everything they don't teach you in dental school. And that's the best place where you guys can talk to me one-on-one. Have a lot of good stuff coming in there, working on a course, one-on-one, you can work with me, and much more in the future. So please, it's completely free to join. Hope you like this video. Like, comment, subscribe, and I'll see you in the next. Peace.